Right. So Neha, your letter tells me that you're planning to take the test on 27th. So I thought I could have a session with you wherein we could discuss your mock test attempt and I could give you feedback related to it. So let's first talk about the letter in detail, what you've written and what was expected, and then we'll talk about the general thing on whether what things you need to work on when it comes to test preparation. So when we look at the layout, the date of writing has been correctly put with the recipient's details. So good job. When I look at the subject line, you've written the date with slashes, the date of birth. But when you're putting slashes, you've written the name of the month. So if you're writing the name of the month, you should not be putting slashes. And if you're putting slashes, then write it in numbers. So rather than writing 25 slash July slash 1958, it's better that you write 25/07 because July is the seventh month. So 07/1950. Otherwise, the layout seemed quite well to me, and you have a good understanding of it. So good job. Then let's talk about the introductory paragraph. You've written Mr. Adam White colonoscopy. Here, you're talking about colonoscopy of Mr. White, right? So apostrophe was to be put with Mr. White. So Mr. Adam White's colonoscopy. And the spellings of colonoscopy, because we pronounce it in the class, many of you, as colonoscopy. So you've written it as colonoscopy. It's colonoscopy. So COLO. So make sure that you proofread your letter. Yeah. And these spellings are also there in the case notes. So it's better to read the case notes and then check the spelling so that we can avoid such minor errors, which can have a major impact on the writing. Is scheduled on 9. This correct sentence is correct grammatically. This letter is to inform about his. His is the determiner that you could add in order to specify whose pre-procedure assessment are you talking about. Now, in this case, what you could have also done, Neha, is that in the brackets, you could have put the information about the height and weight of the patient. Or when you were writing about the assessment today, you could have written about the height and weight. You've not included any information about it, but it's very relevant because according to the height and weight, the sedative would be administered, the anesthesia would be administered. So this information was really very relevant. Either in the brackets with the patient's name. Yeah, sorry, you were saying something.
When height and weight included in introduction.
Either you can put it in the brackets. Mr. Adam White, bracket, height, colon this, weight, colon this. Or you could write, when you're writing about today's assessment, all the pathology tests were performed. There you can write his height is this and weight is this. Any which ways.
Okay.
But it was a relevant piece of information. Okay. Now, when I read your introduction, although there are some grammar errors and spelling errors, but I am able to understand why you're writing the letter and what's the reason the letter is being sent to the recipient. So it's quite clear. So good job on that. Then let's move on to the next paragraph in which you have written about the patient's family history as well as the medical history. Here, if you see the third line, you've written and had a possibility of bowel cancer. Now, if you see the sentence construction, you've written his family history is remarkable for colon cancer in his father and had a possibility. The family history did not have a possibility. The family history is the subject. So, in this case, had was not needed. We would directly write family history is remarkable for number 1, colon cancer. Number 2, a possibility of bowel cancer. Okay. Again, except for that had part, the sentence did make good sense. Then you've written the medical history of a patient. Medical history reveals that he had constipation since 2014. First of all, grammatically, this sentence is incorrect, Neha, because since would mean that it started in 2014 and it's still continuing, but the case notes do not suggest that. Second, it's already mentioned that the constipation is related to possibly wrong eating of foods. So it is not related to the bowel changes that the patient is now experiencing. That makes this information irrelevant. It was not to be included. What was to be included is that because of the significant family history, as well as the positive bowel cancer screen test result, the patient is now concerned about the possibility of having cancer and wants a colonoscopy. So you've written the purpose in the introduction, and the supporting information of the purpose are two factors. One is the family history. Second is the positive bowel cancer screen test. So the information about the bowel cancer screen test, which is in the third paragraph, which makes the patient concerns, should be in the second paragraph. Okay.
Okay.
I hope I make sense. Any questions here?
No, ma'am.
Okay.
Ma'am, he is concerned about the possibility. Uh, it's mentioned in second paragraph.
It is to be mentioned in the second paragraph. Because that's the reason
Okay,
why the colon cancer, that's the reason why the colonoscopy needs to be performed.
Okay, ma'am.
Then, in the next paragraph, you've mentioned Mr. White has been presented to us. Has been presented, number one, it's present perfect tense, and it's used when the patient is brought by somebody else. Did somebody else bring the patient to you, or did the patient come himself? Did the patient come himself, or was there somebody who brought him?
When come by itself.
Yeah, the patient came himself, though. So we won't write has been presented. We'll simply write presented because we will specify the time when that presentation happened. So we'll write today, Mr. White presented. If you don't mention that the presentation was today, the recipient would be quite confused. So it's very relevant to mention that today, Mr. White presented to us with vowel changes. Now, after vowel changes, there needs to be a comma because we are joining two independent clauses. One is to be presented with vowel changes. Two is vowel tests are abnormal. So since two independent clauses are being joined, they would be joined with a comma. Yeah, and this information, as we already discussed, that he's concerned about the possibility of cancer because of the family history, will be with the details of the family history, so that there is no repetition of information, and both the ideas which are similar can be together in one paragraph. Okay.
Okay.
Then, additionally, you put a comma. So after commas, we don't have the next letter in capitals. So H would be in lowercase. He's sensitive to codeine. After codeine, a comma is again required. And there would not be any comma after so, because so is a coordinating conjunction. It cannot start a new sentence, but it can join two sentences. So it will be joining the two sentences. Since it's joining the two sentences, it will have a comma before. And after letter, again a comma will be there because you're joining another independent clause. You will need to inform your staff about it. Your, what are the spellings of your, Neha?
Ma'am,
Y-O-U-R. And you have written you are. So WhatsApp language is not to be used. It's informal. So make sure that you read the letter before submission so that such things can be taken care of. Right. So otherwise, this paragraph is okay. We'll have to exclude the information of family history from this one and put it in the second paragraph so that there is clarity of information and so that the ideas flow smoothly. Then when you're writing about the pathology test today, again, after comma, P would be in lowercase, not in capitals. And you're giving extra information about the pathology test, right? You're giving the names. So such as, and then the names of the tests will be in commas. And since after LFT, again a comma, because such as FBE, UNE, and LFT, these are the three tests that you're writing about. So they would be within commas. And before LFT, you've not added and. This is the final item, no? So when you have three or more items in a list, the final one is added with the comma plus the conjunction. Yeah. Again, after ordered, we'll again put a comma because we are beginning our non-restrictive prepositional clause, the results of which will be available before the procedure. So punctuational errors are there. I'll share the lesson on punctuations with you. You can go through it so that there is no confusion related to the usage of comma. Following this, the sentences that you've put in this paragraph are very well written, very good connection, very good sentence markers and beginners. Very well written paragraph, I would say. This was the best paragraph of the letter, so good job. In the final paragraph, there is one error. You've written it would be appreciated if you could do further counseling. Now, let me show you the case. Just give me a second and let's play my screen. If you see, they've mentioned in the plan, review 1 week post procedure by doctor and nurse and review progress, further counseling and other options. So the review of the progress, further counseling and other options will be done by the sender of the letter, the doctor and the nurse, not the recipient of the letter. So you cannot request the recipient of the letter for further counseling. while you in your letter have done that. So it would be appreciated if you could do further counseling. Would be incorrect understanding of case notes. I would not suggest that you write this sentence. Instead, you could have written that he will be reviewed as the results after the results of the procedure, because those will determine the further course of action. And accordingly, we will provide further counseling to the patient. So the further counseling is by the sender, not the receiver. So what I would suggest is that you read the case notes very carefully so that you're able to identify what task is to be done by the sender, what task needs to be done by the receiver. Any questions till this point, Neha? Anything that's not clear?
Ma'am, clear. Ma'am, actually, I have difficulty in connectors.
The use of
Connecting two
connectors?
sentences.
Okay.
Yes,
Okay.
ma'am.
All right. So Neha, for this, there are two ways of going about it. If you think you have time of connecting if you have time to prepare for connection of ideas, then I'll share the lesson on conjunctions as well as the lesson on connectors. That will give you an idea in what situation, what kind of a connector and conjunction is to be used to connect ideas. And if you think that still you would be having a lot of difficulty, then what you can do is you can write independent sentences. Rather than misconveying the information and using wrong connectors, I would suggest if you could skip it. But still, we have some time before the test. So I'll share both the lessons. You can go through them. Okay?
Okay, ma'am.
Right. Now, to talk about the progress from this point on, how are you supposed to move forward? For that, we need to understand how was this performance. I think this was a fair performance. It was not bad at all. But yes, we can make it quite better. How can we make it better? With the minor errors in choice of information that we've done, we can work on that. And the minor error in organization. That one sentence related to families information, if we put it in the previous paragraph, this can make the choice and organization both better. Second, make sure what action happened when. The timeline needs to be very clear. When the patient presented, when the patient's history happened. All of those need a lot of clarity. And third, we can work on our language, especially correcting spelling errors, using punctuation, correct punctuation, and as you mentioned, connectors and conjunctions. So if we work on all of them, those are minor little things, minor little topics, but they can have a major impact on your writing. So what I'll do is I'll share lessons related to all of them. You can go through them and then write the next letter. And as far as the spelling errors are concerned, most of the spellings that you've made errors with, for example, colonoscopy and practice nurse at the end, they were all given in the case notes only. So if you can just compare them with the case notes for the ones that you confused and proofread before submission, you can easily take care of it. Yeah?
Yes, ma'am.
Right. Any questions, Neha, then?
No, ma'am.
No? Then I'll share the lessons with you. Thank you for giving me the time. I'll see you soon. All the very best for your preparation.
Thank you so much, ma'am.
Take care. Bye-bye.
Bye, ma'am.